them out to you, and then we can also take them from you. And just do me one favor, if there's an empty seat next to you, would you raise your hand? Okay, so staff, and for anyone who's been looking for a seat, it's incredibly full, but we do have seats that you can put your hands down, thank you. So just know people who are in the back and who might still be looking for a seat, there are a few of them left. And now I'd like to turn it over to our next presenter. Take it away. Oh, wait, Susanna, one more
very quick announcement. Somebody lost their keys. I don't want anybody to leave early. Ocean Line Cruises, keys. It doesn't give you an Ocean Line cruise, but it's a key that has an Ocean Line Cruise tag. Okay, if it's yours, come and see me.
Great Ocean Line Cruise.
2 keys. Okay.
Okay.
Thank you.
So, my name is Carrie Tracy, and I work at the Community Service Society of New York, and I'm a certified navigator. And everyone at my organization is really, really excited that we get to be navigators. As I'll talk about a little bit later, we've been working with folks for a long time through a program called Community Health Advocates, and everyone I work with has had the experience of sitting down with someone who needed to get some health care and going through all the possible options. Do they qualify for a public program now? Does Healthy New York work for them? Can they afford to buy a plan on the marketplace? And just having no, and having to help somebody try to find free or low-cost care because they just can't get into any kind of coverage. And so we have been waiting and waiting and waiting for 3.5 years for October 1st, and we are so excited that it's here and that we get to be a part of it, that we get to be navigators, and we've already started to enroll people and get to say, yes, we have a good option for you, and you can afford it, and it's great coverage. So it's really exciting for me to be here, and so I'm really happy to be a part of this. So I'm going to talk about some new options that are available for consumer assistance and what you can expect if you get to sit down with a navigator. So as Alice said, I think this is sort of a repeat of her slide. There's a lot of different options if you want to get help. If you start sitting down at your computer and you're looking through the website and you have some questions, you can call the Consumer Support Center. There's a live chat function, or you can get help from a navigator or a certified application counselor or a broker or agent. So this diagram kind of shows what an individual would kind of go through as they're trying to get to the final point of having their coverage. And a navigator or a certified application assistant can help you through each of these steps. So the first step is to create an account. So the website will ask you for information about yourself. And so you'll be entering some information, and it will do an identity proofing check to make sure that who you say you are, to protect your identity. So at this point, the website might ask you for questions, might ask for follow-up information, and you'll need to enter that information, and a navigator can help you figure out what information you need to enter. The next step, once you've got through that and it's clear who you are, you'll be asked to fill in some information about the members of your household. And this can be information like their name, their birth date, their social security number, things like that. So you'll want to have, before you sit down to do the enrollment on your own or with a navigator, you want to make sure that you have all this information handy. And in the past, if you've tried to qualify for a public program like Medicaid, you would have had to produce all kinds of documents that you have to produce in person. That's not true anymore. For most people, you won't have to produce any documents. You'll just have to have the information. So having the documents handy is a very good way to get that information. So even though you might not have to turn in your social security card or something, it's good to have all that on hand and prepared before you start the process. So then, as you're filling in information about your household, you might get asked some questions. Like if you say that there's a 19 or 20-year-old person in your household, the website might ask, is that person a student? Because that'll change their eligibility for some programs. So there's some back and forth, some questions and answers. And once you've got your household settled, it'll ask you to fill in information about your household income. So eligibility for these programs is based on it's called the Modified Adjusted Gross Income. It's the measure that the IRS uses. So having your last year's tax return on hand, things like your pay stubs, any information like that to help you figure out what your income will be for 2014 will be helpful to you. So again, there might be some questions. If you enter your information about what you think your income will be in 2014, and it varies a lot from what your income was in 2012, you might get some questions like, why is your income changing? And then you might want to say, you know, I have a new job, I'm on unemployment. So there might be some follow-up questions and answers there. At this point, once it's got all your information about your household and your income, the website will be able to make a determination about what you're eligible for. So first, it'll screen you to see if you qualify for Medicaid. If you don't qualify for Medicaid, then it'll screen you to see if you qualify for the tax credits to help you pay the premiums, and if it'll screen kids to see if they qualify for assistance with Child Health Plus. At that point, the website will tell you, here's what you qualify for, and you'll have some decisions to make. As Alice said, if you qualify for the tax credits to help you pay the premiums, you can either choose to take it all up front, you can choose to take none of that assistance up front, pay the full premium, or you can actually choose somewhere in between. So you'll get to think through, is your income really, really predictable? Do you make the same amount every year? In that case, you can probably take the full amount and not worry that your income will change over the course of the year. If you're somebody who has variable income, you might want to play it safe and not take the whole credit. Whatever you do, if your income changes throughout the year or your household changes, you'll want to go back to the website and enter that information, because that'll change your eligibility. And you'll want, if you need help, if you went to a Navigator in the first place to enroll, you can go back to that Navigator and ask them for help updating your information. So once you know the level of tax credits, you know what you're eligible for, then on the right-hand side, these 4 categories, you'll have to pick a plan. So one thing that's really exciting about New York State, one reason New York State is better than anywhere else, is that we have a program called Emergency Medicaid. Many states have this, but New York recently made it so that people who qualify for Emergency Medicaid can pre-qualify for 12 months and can find out ahead of time if they're eligible. And this is a program for folks who are income eligible for Medicaid, but for some reason, other reason they don't qualify, like immigration status. So people who go through the website can find out that they're eligible ahead of time and know that. And this will help a lot of families, especially like say families with mixed immigration status. Some folks have one status and some folks have another. Everybody can figure out together kind of what they qualify for. So that's exciting. If you qualify for Medicaid, then you'll be able to pick out the Medicaid managed care plan that you want to choose and enroll in that right on the spot. If your child qualifies for a Child Health Plus, then they'd be able to enroll in that. And finally, if you don't qualify for a public program, but you're going to buy a qualified health plan with these commercial plans, either with or without the tax credits, then you'll be able to go through and choose the different plans. So the website is really exciting, and the choices that New York has made will make it much, much easier than ever before to pick a plan. Because in the past, like say for small businesses, in New York State there were 15,000 plans that small businesses could choose between. And there's no way that you can compare plans, right, when there are that many choices. But because the plans have been standardized in a lot of different ways, it's going to be much easier to compare plans. And you can actually do that thing like on like your cell phone plan, you can put 2 different phones up next to each other and it tells you what the difference is. You can do that with health plans now. So you can see, put them side by side and do some comparisons. You can look for more information, get a lot of information about the plan. So again, if you're doing it on your own or you're sitting down with a Navigator, before you get to this stage, you'll want to start thinking through who are the providers that you see a lot? Who's your primary care doctor? Are there any specialists that you see? How often do you see these providers? Is there a hospital that you like to go to in particular? What kinds of drugs do you use prescription drugs do you use on a regular basis? Because every plan is going to have different networks, different drug formularies, so you'll want to be able to compare, which plan has all of your doctors in network, or if you have to choose between 2 plans that have, one provider and another provider, who do you care about more? Who do you see more often, so that the cost sharing differences kind of all add up to a plan that makes sense for you. Also, if 2 people in your family have different health needs, you could get 2 different plans for them. One person in your family could qualify for Medicaid and another person for a qualified health plan. So there's a lot of different choices, so hopefully you'll be able to find the choices that work for you and your family members. So we put together a couple of examples here to kind of walk you through what this would be like and the kinds of choices that people would make. So this is a story about Angie. She lives in Queens. She just graduated from college and she has a new job that doesn't offer health insurance. A lot of young people are finding themselves in this position, right? So she makes enough income to have, her income is 250% of poverty. So she qualifies for the premium tax credit. Remember we said people up to 400% of poverty qualify for these premium tax credits. So she finds out that her monthly premium subsidy is $172.26 a month. It's based on the price of a silver level plan, the second cheapest silver level plan in your county. So Angie's able to take that subsidy, even though it's based on a silver level plan, she can buy a plan on any tier. And plans are sorted out into tiers according to their value. So she goes to she takes her premium and goes for a bronze plan, which is cheaper. And so once you take, the monthly cost is $334, she applies her $172 tax credit, and so her premium every month is going to be $162. So she knows that her income is pretty stable, and so she chooses to take the whole premium tax credit up front. This is another example, and this is a family with a bunch of different family members, so it's a little more complicated. So this family has two parents and one income. They lost their coverage because the dad recently lost his job, and that's how they had their coverage, so they want to get coverage. So they find out that based on their income, they're at 200% of poverty, which means that they qualify for both the premium tax credits and also the cost-sharing subsidies. So their monthly premium subsidy is $483 a month. So they look at all the plans available and they choose a silver level plan for the parents. Their kids qualify for Child Health Plus, so the kids' premium is only $9 a child. The parents' premium is $770 a month, and they take out that $483, and they end up with a monthly premium of $287. Now, one thing that's really important to notice is that while you can take the premium tax credit to any plan on any level, if you want to get the cost-sharing subsidies, you have to buy a silver plan. So the Okofers decide to take a silver level plan, and that means that they'll have greatly reduced cost-sharing. When they go to see the doctor, they won't have the same deductibles or cost-sharing, co-payments, co-insurance. That'll be reduced. So we want to make sure anyone who qualifies for those cost-sharing subsidies, make sure that you're looking at the silver level plans. And then I have an example of a small business, but this will make more sense after Marcia does her talk, so maybe I'll leave this and not go through it. But there are also tax credits and great prices available to small businesses. So this is the Community Service Navigator Network. So at our agency, we work with a network of 38 groups that serve consumers and small businesses. As you can see, we're all around the state. We work in 61 counties. And you can look at our website, cssny.org, or you can check the state's website to find some navigators who are in our network. And as you can see, some of the groups specialize in serving one community, but everybody on this list can serve any community, anyone who needs help. And we can also help folks find the organization that best serves them if you give us a call. And I'm going to give you our number and our information in a minute. So I also wanted to give a plug for Community Health Advocates. This is a program that we've done for a long time at CSS. We help people post-enrollment. So say you've got your new insurance, you haven't had insurance in a while, and you need help figuring out how to find a provider, or how to, if you have trouble with a bill that you don't think you should have, you need to figure out how to get that settled. Or if it's somebody who finds that they're just not able to get any coverage, we can help you figure out how to get low cost or no cost care. So this is some resources. Alice has already showed you the New York State of Health website. CommunityHealthAdvocates.org is our website for community health advocates. We have a lot of really good information about how to use insurance. And we have a toll-free number. So this number, 1-888-614-5400, we want to have no wrong doors. So if you call that number and you need help with your insurance, we'll get you somebody who can help you use your insurance. If you want to sign up, you want to meet with a navigator, call the same number. We'll use that to help you get an appointment. If you want to make an appointment with any of our partners and you don't have their number, just call that number and we'll help you get set up with an appointment with our partners. The Small Business Assistance Program is another network of groups that help small businesses figure out whether they qualify for tax credits, figure out insurance, and help figure out how to use the insurance once they've got it. And Marcia's one of the groups in her organization is also part of that network. So we have a new website with a blog that's got information for small businesses. Healthcare for All New York is a coalition of organizations that advocate for healthcare for everyone in New York, and we again have a great blog there. It has a lot of information about healthcare reform in New York State. And finally, healthcare.gov is the federal website for folks who don't have a state that set up its own state marketplace. You can go there for more information.